Good morning, afternoon, and evening to all participants. My name is Emma Fournet. I'm a part of the Interfaith Health Program at Emory University, and today we'll be doing a webinar on designing a program to demonstrate impact. The presenters for today are John Blevins of Emory University and Jill Olivier of the University of Cape Town. As reminders, all participants are currently muted, and we will unmute you during the discussion portion of the webinar. And if you have any questions, feel free to use the chat function on this webinar, and we will try to answer your questions. And as a reminder, this webinar is being recorded and will be uploaded to the Interfaith Health Program website later this afternoon. Okay. And so to get started, we have Dr. John Blevins, who will get the webinar started.
Thank you, Awa, and greetings to participants on the webinar today. I'm John Blevins, and I am on the faculty at the School of Public Health at Emory University, and want to welcome you to this webinar and to the webinar series. This webinar is one of the activities of a joint initiative between UNAIDS, the Joint United Nations Program on HIV and AIDS, and PEPFAR, the U.S. President's Emergency Plan for AIDS Relief. And it is a joint initiative designed to build partnerships and collaboration between PEPFAR, UNAIDS, and global HIV funders and their faith-based partners at local, national, and global levels. One of the implementing partners of the joint initiative is a consortium of universities that provide research and technical support to the project. Those universities are Emory University, which is in Atlanta in the United States, the University of Cape Town in Cape Town, South Africa, and St. Paul's University in Limuru, Kenya. This webinar series has been developed jointly between researchers at the University of Cape Town and Emory University. This webinar series grows out of meetings of the implementing partners that were held in September of 2017, in which various implementing partners asked UNAIDS and PEPFAR for some platform for capacity building to understand how faith-based organizations can more effectively respond to funders' priorities and funders' expectations related to their work, with an idea that faith-based organization staff would be best equipped to do this by understanding the ways in which funders develop a program and think of the priorities and objectives for that program, so that faith-based organizations can better understand how they can develop a proposal or work with funders in regard to those priorities. This webinar series consists of 4 different webinars. Our first one was held in November. The one you are participating in today is our second webinar and builds on the elements that we introduced in the first webinar, which looked at using a logic model to design programs. There are 2 final webinars in 2019, one in February of 2019 and one in March of 2019, and I'll speak of those at the end of this series. So before we begin, I wanted to allow my co-presenter today to introduce herself, and so I'll turn it over to Jill Olivier. Jill.
Thanks, John. My name is Jill Olivier. I'm a professor at the University of Cape Town in the Health Policy and Systems Division of the School of Public Health, and I'm also the director of an international collaborative called the International Religious Health Assets Program. Thank you, John.
Great. Thank you, Jill. So I wanted to start by naming our learning objectives so that you can understand the content for today's lecture. There are 5 objectives for today's lecture. One is to describe the flow and the relationships across the elements of the logic model. This is builds on the presentation from webinar 1. Number 2 is to define elements of the logic model, specifically outputs, outcomes, and impact, to define and describe the differences across those. Learning objective C is to describe methods that are used for measuring outputs, outcomes, and impact, both quantitative, qualitative and mixed methods approaches. Learning objective D is to apply the concepts that we presented in the various aspects of objectives A, B, and C in a variety of cases. And E will just be a discussion amongst ourselves on the ways in which the capacity that needs to be built for demonstrating evidence, for carrying out evaluation, can be an intrinsic resource for the organization itself. So how can the resources we put toward being able to carry out evaluations be a resource for the organization and not meet only the needs of the funder, but also improve the organization's ability to understand what it does? Next slide. So the first objective is to describe the flow and the causal relationships across the logic model. So the element you see in front of you is the logic model that was presented in webinar 1. And in webinar 1, we introduced the idea of causal relationships between inputs, activities, outputs, outcomes, and impacts. We wanted to briefly summarize that approach and those elements for those who are joining for the first time. Next slide. Inputs, the first element in a logic model, refer to resources that are available from the organization itself. Inputs can include aspects such as personnel, the capacity of an organization to carry out programs, either existing capacity or capacity that can be built as a result of funding, keeping in mind that if you have to build capacity, that will have an impact on your timeline for being able to carry out activities, and the amount of funds available to carry out your work. Inputs can also be elements that organizational partners bring to the table or others in the community bring to the table by virtue of your relationships in the community. And finally, there are qualitative elements that can also impact the program and the ways in which activities will be carried out and achieved. Those kinds of activities that are important for faith-based organizations to be aware of and to have some sense of their the resources that they represent include trustworthiness, the kind of social capital that's invested in religious authority, issues of longevity and time of a faith-based organization being present in a community, and questions of what motivates a faith-based organization to carry out its work. So inputs are often, from a logic model standpoint, those elements that can be assessed in more quantitative measures, but they're also less tangible aspects to inputs that are important for faith-based organizations to assess. Next slide. Based on the inputs that you have available, there are activities that you will be carrying out as an organization. The question organizations need to ask themselves is the following: are your proposed activities feasible in light of the inputs you have available as an organization? At times, funders try to build organizational capacity with the best of intentions, but there are times, and there have been instances in which they develop a funding opportunity and specify activities that will be the focus of the funding, which are beyond the scope of organizations whose capacity that funders are trying to build. Organizations may apply for such opportunities, they may get funding, and then there have been instances in which they're set up for failure because they cannot carry out the activities with the inputs that they have at their disposal. And so when thinking about what's feasible for your organization to carry out in regard to funders' expectations, it's essential to understand your capacities in light of the inputs you bring to the table. Next slide. The next element are outputs. Do the outputs generated through the activities you carry out through the program reflect your organization's priorities, your funders' priorities, and where do the community's priorities fit in? Outputs are the things that are achieved through the activities you carry out. One way to think of this is to think of your activities as the thing your organization does, the verbs, and then to think of the outputs as nouns, the things that are accomplished as a result of those activities. Next slide. The final two elements, outcomes and impacts, speak to the things or the change that's accomplished by virtue of the activities carried out that generate your outputs. These last two elements, outcomes and impact, are the elements that are often evaluated in regard to understanding the kind of change that an activity or a program achieves. Next slide. What's the difference between an outcome and an impact? If outcomes are more short and medium term and they focus more on individual or maybe organizational level changes, impacts are more far reaching than outcomes. Outcomes are short and medium term, impacts are longer term and more systemic. Finally, then, if we think of the relationship across the domains, then outcomes and impacts, the change that's accomplished by virtue of our work, can only be achieved, excuse me, can only be achieved with the correct and sufficient kinds of inputs. And it's important to think of having both the correct inputs, the necessary inputs available, and having sufficient capacity in regard to what those inputs offer you as an organization. The appropriate activities are achievable only in regard to the inputs, and you need to think of activities being both feasible and effective. Feasible in regard to the capacities your organization has, and effective in regard to what the objectives of the project are. And finally, the relevant outputs that address the priorities of your organization are measured in regard to outcomes and impacts. But the question related to the outputs is a question of objectives, and the priorities of your organization, your funder, and the communities you serve have to be taken into account. There may be times in which there are tensions across those kinds of objectives or those kinds of priorities of the different bodies, and your organization will have to balance the expectations in regard to those different priorities. So there is a relationship across these 5 elements that we want to talk about a bit more today. So I want very briefly then to define a little bit more the difference between outputs, outcomes, and impact. Sorry about that, everyone. We're now back onto the correct slide. So we wanted to define the differences between outputs, outcomes, and impacts. We define outputs as the direct effect of activities. They are the things that are accomplished through our work. We define outcomes as the changes brought about by the outputs. Outcomes often are changes that occur at individual or local or specific organizational levels. And we think of impacts as having broader macro level systemic changes. One of the challenges for programs comes about when they overpromise to their funder the effects of their activities, promising impacts when they can only feasibly manage outcomes at best. Outcomes address more individual effects. They can occur more quickly, but they may not represent a significant and enduring change. They are easier to measure. We can measure an output in a variety of different ways, which we'll talk about in just a moment. Impacts allude to a larger scale macro level change. Generally, outputs that reach the threshold of an impact require addressing multiple factors at a macro level. And this presents numerous programmatic challenges that are resource intensive, and it can be difficult to develop a program in terms of a hypothesis in relation to those various factors. And so it can be difficult to evaluate impact, but it's the thing that funders are often most interested in affecting a change around. So often organizations carry out a program that generate outputs that can achieve short and medium term outcomes, but they propose their outputs by promising impact. As a result, there's often a mismatch between program capacities and the staff's concept of activities, and the funder's interest and expectations and priorities. Programs carry out activities that are outcome outputs, but they've made promises to funders that they anticipate that they will be able to achieve impact, and they may run into tension with the funder when they're unable to do so. Next slide. So if we think about the differences between outcomes and impacts, how can we measure that, and what are the ways in which such measurements can happen? So I want to talk briefly about methods for measuring the three. First, I want to talk about an outcome evaluation. Outcomes are the shorter and medium term kinds of changes that happen at a more localized and more micro or meso level. Outcomes can be measured using both quantitative and qualitative assessments. I want to give you a brief example related to HIV. Your organization receives funding to equip the staff and your organizational partners to work more effectively with people living with HIV. So your objective in regard to your funding is to increase your staff knowledge and skills, and to ensure that your staff present respectful and courteous attitudes toward people living with HIV, with the assumption that often people living with HIV experience negative attitudes that are motivated by stigma. A quantitative evaluation can be used to measure change in knowledge and skills, the kinds of changes that happen through your staff as a result of this activity. And a qualitative evaluation may measure change in attitude or perceptions, a way to understand the complexity of the various ways staff members perceive or think about people living with HIV. Sometimes we use both approaches, a mixed method approach, to understand what the program has reduced in regard to change. And in this kind of activity, we would probably use a mixed method approach here, and I'll talk about specific approaches in just a moment. Before I do that, I want to talk about impact evaluations. Outcome evaluations or outcomes are significant, but they're often not sufficient, or they're not sufficient on their own to lead to systemic change. And so your program in this hypothetical may change important elements of your organization, but it doesn't necessarily ensure that people living with HIV receive high quality service free of negative attitudes and stigma on a broader, more systemic scale. That's an issue related to impact evaluation. Next slide. So impact can be measured with mixed measured approaches across various factors. This kind of measurement of various factors is essential for generating knowledge of the relationship of those factors to each other that's going to have that's going to impact the kind of change you want to see. So let's go back to the example I mentioned before. In the previous example, your organization successfully changed the providers and your partners' knowledge, skills, and attitudes. Those were outcome outputs. Your funder wants to know if these changes can improve services for all people living with HIV across the board by lowering barriers into care, increasing retention in care, and improving adherence to antiretroviral therapies. That's a larger scale impact evaluation. It's much more difficult to measure that. Evaluating whether these kinds of activities would be sufficient to achieve such kinds of outputs requires an impact evaluation. To assess these kinds of outputs, we have to evaluate other factors, and we would need to carry out activities to address those factors. This can very quickly become quite expensive and quite complex. We might need to carry out activities to build trust among people living with HIV, trust for organizations. We might need to address stigma in our local communities, for example, in our places of worship and in the broader community. We might need to address structural barriers related to access. Those could be distance, transport, costs, and we might need to assess whether people living with HIV are keeping their appointments with their service providers and taking their antiretroviral regimens correctly, consistently, and in a timely manner. So if we want to evaluate the kind of outcome that our funder in this hypothetical is most interested in, we would need to carry out some way of evaluating all of those elements and the relationship across the factors that contribute to those elements being achieved or not. And so outcome evaluations require a baseline assessment because they're measuring systemic change. Now, as you might imagine, the second scenario is much more comprehensive. It's also a lot more complex, and it's a lot more costly. And your organization may very well want to advocate to your funder that such outputs at this impact level are likely beyond the scope of what you're funded to do. It's often quite important for organizations to say to funders that the kinds of questions they are asking are important questions, but they're not necessarily the questions that you can answer related to the activities that you're able to carry out and that you were funded to carry out. Having talked about the difference between outcome and impact evaluation, I now want to talk about the difference between quantitative, qualitative, and mixed methods approaches. A quantitative approach is an analysis of the concrete, or for example, of concrete data, for example, numerical data. Examples of those kind of data would include data on health services, the number of people served, the number of appointments kept, the number of people who maintain adherence to their regimen, the number of people who were retained in care over time. Data such as this could also include expenditures, such as financing of services and the ways in which financing is carried out, the elements of financing. And then in regard to the efficiency of an organization, the relationship between health services and financing by calculating some form of unit cost. Quantitative analyses include clearly defined indicators, so the elements of the data to be measured. What are we measuring by the data? And the metrics, the units by which the measurement would occur. In the example I gave above, a unit cost is an issue of metric that is determined by the indicators of data based on health services and data based on expenditures or funding. The objective of a quantitative evaluation is to calculate the data and to identify results that are verifiable, to generate results that are verifiable. In other words, another evaluator conducting the same process should be able to reach the same outcomes with the same set of data. The soundness of the evaluation depends on the soundness of the data and the approach to calculating what you're seeking to find from that data, as well as the accuracy of your calculation. Quantitative methods are often used to determine either variability or generalizability across context. There are some kinds of programs that will vary in regard to their impact from one place to another, and a quantitative evaluation helps us to understand those variations. And then similar programs in different context and location may achieve largely similar kinds of changes or effects based on the work they do, which leads us to generalizability, that there are elements that we can understand as generalizable from one context or population to another when we assess the function of the same activity. For HIV programs, we often think about these elements as issues such as CD4 rates, whether viral suppression is achieved, how long patients are retained in care, and the cost of providing antiretroviral therapies. Those are all elements that are used or are calculated in regard to quantitative evaluation elements. Next slide. A qualitative evaluation allows us to analyze a complex phenomenon that can't be examined through concrete data alone. A qualitative evaluation helps us to understand perceptions and beliefs, attitudes and motivations. And as you think about this is why qualitative evaluation can be very important for faith-based organizations, because there are distinctive characteristics to faith-based organizations and to our religious communities that are qualitative in nature by their very kind of function and their very ways in which they're conceptualized. The objective of a qualitative evaluation is to describe complexity with depth, not necessarily seeking to determine variability or to generalize ability, but to be able to understand the various factors that contribute to a phenomenon. Qualitative methods help us to understand the effects of those intangible elements on our activities, and they provide us with insight into distinctiveness and innovation. Qualitative methods can help faith-based organizations back up the case that we do something distinctive through our work as faith-based organizations on the basis of evidence and not anecdote alone. Next slide. Two more down. Thank you. Mixed method evaluations are a combination of the two. As the name implies, mixed method evaluations employ both quantitative and qualitative approaches. Mixed method approaches are often used because they're more comprehensive. They help us to speak to concrete elements such as numbers and data, as well as less tangible elements such as characteristics and attitudes. They support cross-validations as long as our findings align with one another, providing stronger evidence of the interrelationship among factors. Keep in mind, however, that the relationship may simply be one of correlation, not causation. Correlation simply means that various elements are evident at the same time, but it doesn't necessarily mean that one element has an impact on achieving the other element. And finally, they offer stronger evidence to make conclusions over time. Conclusions start as a hypothesis, which then has to be tested through a targeted evaluation. One of the things that is present now in our current state of partnerships with faith-based organization and global HIV and global health initiatives more broadly is that we have made a number of anecdotal claims over time that we're just now at a place that we're starting to measure in regard to being able to prove or disprove those kind of anecdotal claims. We can do this if we have a variety of data sources from a variety of places using a variety of methods over time. And so we're now at the stage that we're starting to test our hypothesis through targeted evaluations and projects. Next slide. So having talked about and briefly described the difference between a qualitative and a quantitative evaluation approach, how do we generate data for those two approaches? Quantitative data is generally generated through surveys of participants in a program, of staff members, for example, in regard to knowledge or skills, or by assessing patients' chart records in a clinical HIV setting, looking at laboratory results and looking at patients' activities as a patient over time, whether they show up for appointments, whether they maintain their medication regimen. We can gather quantitative data through fiscal elements of our programs, such as looking at budgets or looking at the results of an audit. Qualitative data is most often gained through talking with participants of a program or staff in a program in regard to their perceptions and impressions. This is most often carried out through focus group discussions, key informant interviews. So asking participants and staff members about their attitudes and perceptions. Qualitative data can also be gathered through observation. Observation of an activity in your organization or the elements of daily practice in a person's life. Analysis of those responses is usually carried out in the form of a transcript in which themes are identified and analyzed in regard to being able to generate a narrative about their impact. Next slide. So Awa, if you could unmute the participants, what I'd like to do now is for us to discuss among ourselves the kinds of methods that work best for these activities. These are all activities that are being carried out in the UNAIDS PEPFAR Joint Initiative. And I just want us to think about what kinds of evaluation methods work best for these activities. The first one is a secondary analysis of existing health services data on the numbers of people living with HIV who are receiving antiretroviral therapy by a health facility at the level of the health facility. This was done so we could understand the percentage of services provided by the faith-based sector in comparison to all services as a whole, or in comparison to other sectors such as government or civil society or private for-profit clinics. So we've carried out this analysis in Kenya as part of the academic consortium. What kind of methods work best to carry out this activity? If we want to conduct this kind of research, are we going to apply quantitative or qualitative or mixed methods approaches? What do you think?
Quantitative.
Quantitative. Is that Dave?
Yeah. Hi,
Hey,
John.
Dave. How are you?
Good. How are you?
I'm good, thank you. So that's right. That's a quantitative analysis. We are calculating numbers of services with an indicator and a metric for how we measure that indicator, and then calculating percentages based on that. Second activity is to convene volunteers who tell us, who belong to key population groups, asking them to describe their perceptions of faith-based organizations, their understanding of the relationship between the stigma that they face as members of key population groups living with or affected by HIV, and the relationship of that stigma to religion, and the role of religion in their own lives. We carried out this work in Kenya as well. Is this activity quantitative, qualitative, or mixed method?
It's qualitative.
Qualitative, yep.
That's correct. It is qualitative. This is a qualitative activity that speaks of perceptions and attitudes and helps us to understand the variety of factors that members of key populations communities must navigate in relation to questions of stigma and religion's relationship to stigma. We're currently carrying out, and University of Cape Town is doing this work, a comparative case study of a large faith-based facility offering both inpatient and outpatient HIV services as well as psychosocial support, and a large governmental facility in the same district offering the same services. We're doing this currently in Tanzania. Is this a quantitative, qualitative, or mixed method approach?
Mixed method?
That's correct. It's mixed method. We're looking both at health services data and chart review, as well as fiscal expenditures, as well as perceptions from participants in those programs related to their understanding of the quality of care that they receive. The Ecumenical Advocacy Alliance, one of the implementing partners, carries out workshops in local communities in various target countries called Frameworks for Dialogue. If we want to evaluate the impact of the Frameworks for Dialogue workshops, and particularly the community engagement plans that are developed through those workshops, would we use a mixed method, a quantitative, or a qualitative approach?
Qualitative.
We largely use qualitative. We might supplement qualitative with some sense of quantitative elements, particularly if we're going to get to an impact evaluation. But you're exactly right. At this stage, we've carried out a qualitative evaluation. The World Council of Churches EHIA program seeks to change knowledge and attitudes related to gender and gender roles through a contextual Bible study activity. If we wanted to evaluate the changes in knowledge and attitudes of gender dynamics through contextual Bible study, what method would we employ?
Qualitative.
That's also qualitative. That's right.
Yeah.
And finally, the Ecumenical Advocacy Alliance has developed a global campaign for advocacy for HIV testing, where religious leaders seek to lower stigma to receiving an HIV test by publicly indicating that they themselves have been tested and advocating for everyone to be tested. If we want to evaluate the changes brought about by this program, would we be doing a qualitative, quantitative, or mixed method evaluation?
For me, it's mixed method.
It is mixed method, although it's also a very difficult campaign to evaluate.
Yes.
Because, yeah, it's one thing we might do there is to do a qualitative assessment of perceptions in local religious communities of those leaders. But one of the challenges through such an advocacy initiative, and this isn't a weakness of what EAA is doing, it's one of the challenges of advocacy campaigns in general, is we're trying to affect a large-scale structural change, and there are so many kinds of factors that can impact testing and uptake of HIV testing in communities at local and national levels, that to try and evaluate all of those elements can actually be quite difficult. So this brings us to our final point, that evaluating all of these outcomes can be quite difficult and complex, and evaluating the outputs in regard to impact can be inordinately so, and may not actually be achievable in regard to one program standalone. So across the entire suite of activities that are listed here, along with other activities that are part of the joint initiative, we might be able to talk about elements that point us to impact, but it will be difficult to say much in regard to large-scale structural impact at any one point in time related to any single activity. Next slide. So that's an introduction to the elements of methods, as well as the distinctions between outcome and impact evaluation. And I'm going to turn it now to Jill to apply these concepts in some cases.
Thank you very much, John. Right, so I'm going to go over a couple of the points that John has already made, but I'm going to try and do it in a more kind of, John was handling the theory and the underpinnings of these ideas, and I'm going to be trying to, for us together to be talking through what this looks like in real world, in real world scenarios. So the one from the previous webinar, we presented a very basic case, which is a relatively common logic for interventions with faith-based communities and organizations. So for those of you that weren't in the webinar, let me just refresh your memory. So a problem, and this is just a generic case idea. So if you have a problem in many rural, no, sorry, Ara, can you just please go back? Ara? Thank you. So you often have a problem in many rural settings with women having too many children too closely together, which impacts, obviously impacts poorly on maternal and child health. If you have this idea that you want to work with religious leaders, and you have a hypothesis that religious leaders are very influential in their local communities, and that you can spread healthy messages about birth spacing with these religious leaders to their congregations, to their broader communities, and improve the situation. You decide to train local facilitators and run workshops with these religious leaders, which utilizes specific religious texts, so theologically appropriate materials, and public health messages about birth spacing. And you do monitoring, such, for example, you count the number of people that attend the workshops, you get them to answer a brief questionnaire about whether they have been influenced by the workshop, and whether they plan to spread the messages in their local congregations. Sorry, John, can I just ask you to mute yourself? I think there's some backlog from your speaker. Right, Ara, can you go to the next slide, please? Thank you. So this is a kind of an idea of a basic logic model that might occur with that kind of logic. So you want to work with religious leaders, and you want to ultimately improve in birth spacing. And this is not, again, this is not a logic model for any particular program. This is just something that we created for this teaching scenario. So you would have inputs such as supporting the training of facilitators, you develop workshop materials, you develop an M&E program, which I'll get back to in a minute. You have activities such as you train facilitators, you hold workshops with religious leaders, and you survey the set of indicators. You have outputs such as effectively run workshops, and for that you might count things like the numbers of participants in the workshops, and whether the facilitators effectively transfer the messaging. you have an idea that religious leaders, that their knowledge on birth spacing will increase, and that this will result in them having an attitudinal change, that religious leaders' behavior will change, and that they'll be motivated to spread this knowledge and this attitude change to their congregations, with an idea that there'll be an outcome where religious leaders will share this knowledge, attitude, and behavior change with their congregations, and that this will have a cascade from their congregation to the broader community, that this change will take root, and ultimately that those inputs and those activities will result in ultimately long-term effects, so long-term outcomes such as improved birth spacing in communities and improved maternal and child health. Right, I'm going to come back to this slide in a minute, so just hold this in your head. Our next slide, please. So in the world of evaluation and in the world of research and research evaluation, very often what happens is people will come to think about evaluation at the end. So once they have gone through that logic and once the program has already been implemented, then they'll start thinking about measurement and assessing and showing the effectiveness of the intervention. I just thought it might be important just to understand that there is a lot of different terminology with regards to these things. All of us come from different disciplines. Words such as impact are understood differently in some of those different methodologies that John was talking about, such as quantitative and qualitative. The word impact is assessed differently in those different fields. And different funders have different ideas, and different implementers have different ideas about what impact is. I think the other issue is that very often you have this term impact and you have this term effect. Generally, in program design and research, what we understand is effect is all of those things. It's both outputs, outcomes, and impact. So it's the things that happen as a result of what you do. And very often there is a lack of clarity and understanding within teams and within program staff as to the difference between things such as impact and effectiveness. And so it might sound like I'm playing word games here, but there really is a need for a coherence within the teams that are implementing and between the funders and between the researchers as to what they actually mean about these words, because generally people have very different understandings. So I would argue, and perhaps you can tell me later whether you agree with me or not, but it's actually when you design the program that you need to be thinking about how you will show its effect and how you will ultimately show this impact on things such as population scale indicators. It really shouldn't be something that you add on or that you finish by bringing in an evaluator. And that is actually why I put that third line in that logic model, which is kind of saying that, you know, this evaluative research aspect is a core part of the intervention. That is in best case scenario. In this particular case, exemplar, there are multiple opportunities to demonstrate effect and multiple challenges for demonstrating impact. So let's go on to the next slide. Thank you. Ara, could you possibly unmute the participants? Maybe we'll take a slight discussion pause here.
Requested not to use lift. Follow this.
Sorry. Okay. So what I would like to know is, does anybody have any suggestions on what would be the research or assessment or the evaluation that you would do on this particular logic model? Any ideas? What would you do to show the effectiveness of this intervention, that it was money well spent? Anybody have any ideas? If there's no ideas, it's fine. I'm willing to jump in, but I just wanted to see if there were any thoughts.
Could it be maybe some kind of data showing I guess the children that were born in a specific time period, and then looking at when they were born?
Okay. Okay, so you're looking at the purple block at the end, and you would try and see whether that birth spacing indicator had changed somehow. Yes?
Yes.
Okay, would that be quantitative or qualitative research?
No, that would be quantitative.
Count the numbers of births.
Yeah. Sorry, go ahead.
Okay. Okay, cool. I'm very glad that you suggested that. So just for interest's sake, I just want you to look further back on this diagram, right? There's a number of places where you could demonstrate something and where you could measure something. So for example, if you look in the orange column, if you're looking at just the training of facilitators, if you were doing some kind of implementation evaluation, you could be really trying to understand how well were the facilitators trained? Were they trained effectively? Were they able to effectively transfer this message of theologically sensitive material across to the participants, for example?
Mm-hmm.
Okay. If you were looking at the bottom of that orange column, looking at surveillance, selection of indicators, you could actually do assessment and research to try and understand what actually are the indicators that we should be trying to track with this intervention. It's sometimes you don't actually know what the effects are going to be until you are midway through the program and the intervention. Okay. In the green column, there are things like effectively run workshops. How do we understand effectiveness? What do we mean by an effectively run workshop? And do we need to know whether the workshop was run effectively or not to know whether it's having the effect that we thought it would be having? Okay. The green column in the middle, the green block in the middle, is massively complex. In that one, just trying to understand whether religious leaders have changed their knowledge, have changed their attitude, and have changed their behavior is a massively complex assessment process. There are huge and extremely expensive evaluation projects where people have tried to work out whether a particular intervention has actually increased somebody's knowledge, changed their attitude, and changed their behavior. And what most of those studies show is that generally you can't rely on people's self-reports of behavior change. So you can't rely on someone saying, oh, bless you. You can't rely on someone saying, yes, I enjoyed that workshop and I have seen the light and I'm now going to change my behavior when I start preaching. Sorry, Arwa, if you don't mind going back. I'm going to change my behavior when I start preaching to my congregation. For example, there's another in that block. There's even the issue about were the religious leaders then motivated to go and actually spread the message into their congregations? And the assumptions in the next blue block, which is that the religious leaders will, after having had a workshop, will not only change their attitudes and their behaviors, but will also then go and spread the message in their congregation, and that the right message will then cascade down into the community, is a huge assumption that would require quite a significant assessment to try and understand. So, for example, there is some interesting research that's been coming out about the failure of cascade models, where it's a bit like broken telephone, where you put a message in at the top and you think it's going to come out at the bottom in the same way, and actually it comes out looking very, very different. And so this assumption that there's going to be this pure cascade of messaging that's going to have this particular effect is something that really has to be looked at. And finally, I want to get to the purple block. The reaction there to say, yes, what we need is some kind of quantitative study to try and assess whether birth spacing has changed is the reaction, the normal reaction to this type of intervention and to this type of logic model. But there are a number of significant challenges to that. Even if you have set out, for example, in this particular example, even if you have set out to have an impact on birth spacing, showing that those activities are the activities that had that impact on that indicator is very, very difficult to do. And you come up against issues such as timing. So, for example, how long between running a workshop with religious leaders would you need before it cascades down and before it actually can be shown on whether on the fecundity or on how many children a woman has? with my researcher hat on, I would judge that that might take at least 5 years to show any kind of change, right? I mean, you couldn't say, in 6 months they had a workshop and then 6 months later they showed a change in number of births. And you might have a chuckle at that, but I have actually seen those kinds of assessments being suggested. So the real challenge, and I'm just using this as an example, the real challenge is that the further there are all kinds of opportunities for assessment and for showing impact and showing effectiveness of an intervention, and there are multiple ways that you can go about doing that. But the further right you go in the logic model, the more difficult it is to show the causal relationship between what you did and the impact you're seeking to show. So showing that it was your intervention alone that had that impact is often very, very difficult. And very often in the kinds of interventions that faith-based organizations get into, they very often are not the types of interventions where something like a randomized control trial would work, where you would run an experiment, right? You would have a community that you were intervening in and a community that you were not intervening in, and then you were comparing whether the intervention was working on community A and not working on community B. The contexts that we work in are so complex, and there's so many different factors influencing those communities that very often those types of classic research interventions and evaluations are just simply not possible or feasible. Thank you, Arwa. Next slide. So a thing to think about, and I was thinking about this while John was talking about different research designs, is that in any evaluation or research, you don't start with the design, you start with the research question. So you start with saying, what is the part of that logic model that I'm seeking to understand better? And part of that is understanding why you want to know that. So what is the question, why you want to know that, and then you move to the how am I going to go about doing it. And very often people do it in reverse. They say, oh, I want to go and do an outcomes evaluation with quantitative data, not really thinking through what is the question they're seeking to answer and why they're seeking to answer that. So in the design of the intervention, and again, arguing that the design of the assessment should be done at that time when you're designing the intervention, there are a couple of considerations that need to be thought of, and John has already raised some of these. There are a number of pragmatic considerations. There are different types of measurement for different purposes. They are differently useful. They have different costs, and they have different timings required. So something that is a participatory evaluation process that accompanies an intervention is completely different to a large-scale econometric cost-effectiveness analysis. They are just different beasts, and you have to really understand what information you need and how much you need that information before you start making those decisions about what it is you want to do. It's really important to try and understand what are what aspects of your logic model can be measured and how is the best way of measuring it. And not all aspects of the logic model, it might not be pragmatically useful to measure every single aspect of the logic model. And again, very often cost is an issue. I don't just mean financial cost, I mean cost of time and energy, cost to implementation staff, cost to the community who you're going to be asking questions of. All of those kinds of things need to be considered when you're balancing out the what do you want to do and why do you want to do it. And the when it will be done is essential when you're deciding on pragmatically what you're going to do. So are you thinking about an end game evaluation that looks across that whole logic model that we were just looking at? So for example, with that previous example, you'd be saying, are we going to be doing an outcomes evaluation that is trying to understand whether this was a cost-effective intervention, whether the money we spent on the religious leaders workshops effectively had the effect that we thought it was going to be having? That is the kind of evaluation you would do at the end. It is completely different to the type of research or evaluation you would do, which would accompany the process and try and inform the research, the intervention process along the way, and try and make it a stronger process, a stronger intervention by showing the areas that need to be strengthened, by suggesting new ways of, by a theory of change process where the implementation staff are part of the process and they gaining greater clarity about the program logic is part of the reason you would do that type of intervention, that type of measurement and evaluation. And of course, as John has mentioned, when you're doing program design and when you're thinking about the measurement, you really have to consider the politics. Measurement for whose sake, who are we measuring it for? Does this measurement meet the needs of the intervention and all the different stakeholders? And very often that process is that process of negotiation between different stakeholder interests, both in terms of the intervention, but specifically in terms of the measurement, is a highly complex process. And that is actually the main business of that type of research and that type of measurement and evaluation, because it's that getting that right, making sure it meets the needs of the intervention and the different stakeholders, that is almost more difficult to resolve than deciding what measures or what style of research you're going to be doing. So, for example, there are some suggestions that at that phase of design, you might need somebody brought in who is, for example, a measurement or evaluation expert, not to do the evaluation at that stage, but literally to lend expertise about what is possible and what isn't possible at the design phase. And to enable an intervention or a program manager to be able to speak back to a stakeholder, speak truth to power back to a funder, for example, and say, do you know what, tracking those large-scale population health indicators such as birth spacing is actually too large for what we're trying to do here. What we really need to do is just understand, whether we use the money wisely by building the knowledge and ensuring that a community trusts each other better, for example. That the outcomes indicator is not the thing we're going to be focusing on. But that generally requires someone able to push back and the expertise to push back against the demands that are placed onto interventions. Next slide. So the last couple of slides, and I'm sorry, we're talking quite a lot, but the last two slides is just thinking about what kind of capacity you need. And again, I'd just like to stress that John and I are not saying that this whole webinar is about evaluation, or it's not about research, or it's not about measurement. It's about all of those things, because I think very often we try to silo these discussions into different conversations, and very much they are actually about the same idea. So sometimes there's a need to make a case for why you would put scarce resources or energy into demonstrating impact or into demonstrating effect. As I said earlier, very often this just happens at the end of a project when an intervention or an implementation team are seeking further funding. And then they go and seek some kind of evaluation that's going to show what they've done in order to get further funding. Or, for example, when a funder requires it as part of a financial reporting system. In the same time, there's also, as John mentioned, quite a significant call at the global scale for people to make the case for faith-based organizations, for example, to ensure that faith-based organizations are seated at the table, and to do this by providing evidence, evidence of their impact, evidence of their outcomes. Those kinds of, I would argue that those kinds of reasons for doing this kind of work are not the strongest reasons to do it. They are relevant, and they are what happens in the real world. But really what we should be trying to focus on is the type of assessment and the type of measurement and the type of evaluation and research that supports the implementation, that supports the intervention, to make it work better, to make it work more effectively. So for example, things like, gathering lessons from implementation change or implementation failure, so that others can learn from those lessons. And because too often we hide the things that don't work and we only publicize the things that do work, and therefore we never learn from our mistakes. We never learn from the things that had to be adapted. We very rarely enable this kind of research and evaluation to feed into evidence-informed decision making, to strengthen learning systems where people have feedback loops and they have interventions that are responsive to the change that's going on in those communities. And there's a moral and ethical responsibility as well, I think. I mean, most of us work in very scarce resource environments. And there's a moral responsibility about understanding, whether what was done effectively and cost effectively. And again, I don't just mean the money. And finally, I work in the field of health systems, and in that world, what we say is, really what you have to understand is not just the program logic of the intervention. You have to understand the ripple effects that you're causing as well in the system. So you really have to understand that you have a kind of an ethical responsibility to understand the unintended consequences of your action, or the things that your intervention, it was not part of the logic model, but the effects that it had more broadly in the community and in the system. And so that's really the type of assessment that broadly people are arguing is really most important. The one thing which we started talking about in the first webinar was this idea about focusing on the type of assessment and the type of measurement that accompanies interventions. So this can be process or implementation evaluation approaches, theory of change approaches. There's a huge global interest in embedded research and evaluation approaches. All of these are approaches which are saying, yes, assessment, measurement, research, evaluation is critically important, but it really is more effective when it accompanies interventions, not when it just appears at the end and has to look retrospectively backwards. Last slide. And so the last consideration that we wanted to just raise was this idea about how do you build capacity for this type of work within an intervention and within institutions. Very often what we hear is that faith-based organizations have very limited capacity for this type of work. They're so busy doing that they don't have a lot of time for doing research and evaluation unless they have to. And so in a sense, it's about, how do we merge different types of resources and considerations to try and think about this. And again, this idea that we might want to focus on the types of, as a community of people engaged with faith-based organizations and faith institutions, the types of approaches that accompany have added value, but also that build capacity within the interventions or the organizations. So it's not about somebody parachuting in and doing this kind of work, but it's rather about building the capacity to do this type of work and thinking and reflection within these systems and communities and organizations. I did just want to note that I think very often if you have a webinar on things like research approaches and evaluation approaches, they can sound quite daunting. They can sound quite, like massive undertakings. And I think it's important to reflect on the fact that, measurement capacity does not mean that staff all have to be able to run RCTs. It really means that the staff that are implementing interventions, or the community members that are running and engaging with these interventions, that they need to have a clear understand of the intervention logic or the program logic, and that they need to understand how the measurement supports that logic. It's that understanding of the connection between what we're doing and what we're seeking to understand, and how those two things support each other, that are really important. So it's really important that staff don't just count participants because the funder tells them they have to, but that they understand that that's a really important indicator for a key component of the logic model. Very often the monitoring in our interventions is the first thing that just doesn't get done because it's seen as being unimportant. And I think it's because we're not making that link clear as to how the monitoring should be improving the work we're doing. It's not just something that goes towards a funder and is something that is required by a funder, or that is information that just goes somewhere and disappears and doesn't come back again. I had a note here. I know that a lot of the large international faith-based organizations that I work with, many of them have a monitoring and evaluation team or staff. And I think in my experience, they are very often both geographically and institutionally separate from the implementation staff. And so they would cook up a set of indicators, and then the implementation staff would seek to try and show those indicators. And I think that's a challenge as well. I think the closer integration between the people doing the implementation and the people doing the assessment is really critically important. And finally, just the thought that there are multiple light touch measurement approaches that when done well can really effectively show impact, can show effectiveness. Things such as reflective practices, community-based monitoring models, participatory engagement. There are many light interventions that can resolve and provide essential information about the effect of an intervention that don't require millions of dollars and multiple external partners to come in. And I think, in a sense, that is a key area for future reflection and engagement. I'm going to stop there and hand back to John. I think we have a couple of minutes for a little bit of, if there are any questions or discussion.
I would also would be interested in your thoughts related to building capacity for measurement and how it can benefit the organization. I remember at the biennial meeting of OCHAP 2 years ago, the leadership making the case that building such capacity was also important because doing so helped, it positioned OCHAP to be able to set research agendas and research questions and priorities in conversation and in an advocacy role with their funders and with their implementing partners. And I wonder what you think about that as well.
Absolutely. I mean, I think so. The next webinar, webinar 3, we'll be focusing on this to some extent. I think, in a sense, for those of you that are not aware, the Christian health associations have a particular position where their role is a very strong advocacy role, where they are positioned as to show the effectiveness of the faith-based organizations to a national, international body, and that is why the capacity for that type of assessment is their priority. I think you might find that within their members, there are different priorities, which might be, for example, understanding the implementation or understanding health service level intervention effectiveness. So I think that there's a slight difference and a slightly different capacity needs between the bodies such as the national and international networks who have an advocacy role versus the bodies whose priority is service delivery. And I think their capacity needs for assessment are quite different.
Thanks, Jill. We have a few minutes for 1 or 2 questions from participants. Do any of our participants have questions on Jill's presentation or on any of the items we've covered today?
Yes, I had one question.
Okay.
It's pertaining to actually your portion, going back quite a few slides where you listed 6 different scenarios and we're asking whether one is quantitative, qualitative, or mixed method. So the question I have is pertaining to the Religious Leaders Advocacy Campaign for HIV testing. You mentioned that it's mixed method, but that it's very difficult to evaluate these types of campaigns. So can you talk a bit more about that? What can be done?
Yeah, in regard to that specific campaign, we've actually had discussions among the implementing partners related to that. There have been times in which staff members from some of the funders, most often staff from PEPFAR, are really interested in this project, but they want to understand the impact that it makes in regard to increased testing rates in the communities where religious leaders reside. Do more people show up for an HIV test, and are we reaching new communities that have largely not been reached in regard to advocacy for testing, with the idea that that's the essential first element to the 90-90-90 objectives for the global approach to HIV, to addressing HIV. And so it's certainly understandable why global funders want to understand the impact of such a project. The challenge is that the Ecumenical Advocacy Alliance doesn't have the staffing, the evaluation capacity, or the funds to carry out an impact evaluation at that measure. Doing so would require some initial baseline assessment of testing rates in places where over 150 religious leaders from around the world have been engaged in the campaign, and to try and then carry out an evaluation on rates over time would require some longitudinal investment on assessing the places where people go for testing. And then we would have to try and convene people who had been tested to ask what was the way in which, what precipitated their decision to seek a test, and whether they indicate that it was the religious leaders' campaign that actually contributed to that. So the idea of being able to demonstrate the impact of that project from the point of view of a standardized evaluation at the level of impact is nigh to impossible, as we talked about in implementing partners meetings. It doesn't mean that the program doesn't have an impact, and it doesn't mean that the program wasn't worthwhile. EAA has worked very hard at that campaign. What I would make the case for, and made the case for, an implementing partners meeting, is that if we want to begin to talk about what difference a program such as that makes, we need to think of different indicators, that it may not be at the level of increased uptake of testing, but it may be at the level of changing attitudes among religious leaders broadly and in faith communities about the idea of getting a test in the first place. So a kind of evaluation in regard to perceptions and attitudes related to an HIV test. And are we shifting ways in which we're addressing the stigma that might accompany a test implicitly, as you only get a test if you've done something that puts you at risk for HIV, and if you've done something that puts you at risk for HIV, you've done something that religious communities and faith communities might frown upon. Now, a lot of religious leaders and a lot of faith communities don't necessarily think those elements in that way, but that is part of cultural kinds of norms in many parts of the world. And the question about that campaign is, did it have an impact in regard to that, more than actually creating an uptake in the number of people who got a test? And that can be done through a qualitative or mixed method approach that's a bit more feasible in regard to being able to speak about the elements related to perceptions and attitudes. So I hope that makes sense, but we push back as implementing partners on the idea that that campaign could actually be evaluated in regard to increased testing rates.
No, thank you. Very helpful.
Sure. Any other questions? Well, I want to thank you all for attending the webinar, and I want briefly to remind you of two final upcoming webinars. They're related in regard to content, and they will be happening in February and March. We are not going to convene a webinar in early January because many people are out of office over the holiday period, but we will convene a webinar 3, on Tuesday, February 5th, and the 4th and final webinar on Tuesday, March 5th. And you see in this final slide the elements and the objectives for that webinar. They're focused on, the webinar 3 is focused on faith-based health facilities, and webinar 4 is focused on faith-based community organizations or local faith communities. And they're webinars that speak to the distinctives of faith-based organizations in the HIV response. So how can we understand those distinctive elements of faith-based organizations and begin to make the case for those distinctives, both in terms of the anecdotal evidence that's there, but going beyond that evidence in generating evidence using the kinds of methods we've talked about today to speak to the contributions and the distinctive contributions of faith-based organizations and faith communities in the HIV response. So we'll convene those webinars in February and March, and we hope you will join us for those. And we thank you for your participation today. Be well. Bye-bye.